Welcome back. February is Gum Awareness Month, so that is what we are dedicating our talk to today with Dr. Preety Desai, who is a laser implant periodontal specialist. It's great to have you back on the show.
Thank you so much.
Yes, so the thing we were just talking about is that when you have problems with your gums, you don't necessarily know it's happening. Unlike if you have a really bad tooth and it aches, you know to go to the dentist and get it checked out. But if it's your gums, you don't necessarily know something's wrong.
It's not painful until the last possible steps of why is my tooth loose all of a sudden, or why do I have bad breath, and my wife or husband keeps telling me. I get a lot of patients saying that to me. So it's not that it's uncomfortable or painful or toothache will keep you up at night. These are very subtle symptoms that one should start to recognize themselves.
So how does one find out whether or not they're in those early stages of gum disease? How do you know?
Well, I brought a few photos today of different stages, so we'll bring that up shortly. But what will happen is that all of a sudden you'll have a sensitive tooth with gum recession. So you'll know your gum is lowering itself. So you're like, well, why is the support around the tooth going? You'll get mobility of the tooth as well, and that means the bone support around the tooth is going, and bone has no nerves, so it's not painful. So it's a slow, silent disease.
Okay, let's take a look at these pictures here. What's the first one all about?
The first one is a very, very typical x-ray that your dentist will take. But what you'll notice in the upper half is that the space between the teeth here, you'll see a little bit of notching and Ving. It's not straight flat like the bottom. Those are the early signs of gum disease where your bone was flat and now it's going north, so to speak.
Interesting. Okay, next one.
Similarly here, you'll see the far bottom left where the wisdom tooth is kind of stuck up against the back tooth, but you'll see a bit of cloudiness, and that is bone loss. So for example, when your dentist says, oh, you need to take out your wisdom teeth because it's affecting the other teeth, that's where the food will get stuck and you'll start to get infection. And it's painful slightly. This x-ray is a patient who has had root canals. You can see all the little fibers up there, but the infection is at the top of the tooth, and it has now made the tooth very wiggly. So there's a two kind of infection going on here, a root canal infection, which can lead to gum infection, unfortunately.
Okay, interesting.
Yeah, and of course a clinical photo without any blood, so we can see that the tooth on the second far right is a little bit browner at the bottom, and people say, why? Yeah, exactly.
Thanks,
Marcel is pointing it out. And as a result, that is gum recession. Those are the early signs of the gum going south. But if the gum is going south, that means the bone has already gone south already.
Okay, gum recession, brushing too hard?
That can play a big role, and we talked about that before, but that is not the primary role of primary sign that you'll see. It's the bone and the gum going first because of disease and inflammation.
And then this one on the far right, you're seeing again that decay or that recession?
That is staining of the dentin, which can start to become decay because the gum has gone south again. Yeah.
How important is flossing in all of this?
Daily. At least
daily. You know what? I'm not going to lie to you. I floss, and I love flossing because I see what comes out from between my teeth, and that is the biggest advertisement you need for why you should keep flossing. I won't lie, I don't floss every day, but I'm about 3 or 4 days a week.
That's
so,
awesome.
you know, I'm doing what I can, but I'm sure that when I see all these little particulate matters coming in my teeth, I think that is better out of my mouth than sitting in there.
Exactly, and it's not painful when you take it out. You don't know that it was there.
And you could be avoiding a major problem down the line.
Exactly.
What about this picture? What are we looking at
So
here?
this picture is a tooth that has completely lost all its bone support. You can see that halo around it at the bottom. That means bone loss has gone from the top of the bone right to the bottom. So this tooth, literally you could move with your finger.
Wow.
So that's how bad it can get.
Okay. So if you think you have some signs or symptoms, something is sort of glaringly obvious to you that something's not right, you should be making an appointment, going in and getting checked out.
And this is why you go to your dentist and your hygienist. They recognize these signs and symptoms that are not painful. They catch it earlier. We can treat it earlier. It's so much easier to treat it earlier than later.
Exactly. It might be even less expensive if you catch it early, too.
Of course, you don't have to do heroics.
Exactly. Which is where you come in.
Which I do every day, but I would rather not. I'd rather prevent than, you know, treat.
All right. Thank you very much for being here today.
My pleasure.
Again, February is Gum Awareness Month. Be kind to your gums. Go and get them checked out. Make sure they're healthy. We're back in 2 minutes. Stay with us.